Another COVID milestone for New York. The statewide mask mandate ends today, and that's as Dr. Anthony Fauci is saying the U.S. is heading out of the, quote, full-blown pandemic phase and that the pandemic restrictions could end soon. And we want to get an update on everything in the COVID realm with Dr. Adam Brown, emergency physician and COVID-19 National Task Force Chair at Envision Healthcare. Doctor, always good to see you here. And let's begin with New York, lifting the mask mandate, not necessarily in New York City. Have to wait, I think, and see what the city decides to do, but also maybe at odds with the CDC. Just wondering how you're viewing the situation.
Yeah, I'll tell you, Jared, I'm a little nervous about it. I feel like we were just here back around the Thanksgiving time, and then Omicron came on our shores. So, we have to remember a couple of things. The number of cases that we're seeing around the country today are essentially mirroring where we were even with Delta during some of the summer. So there's still a lot of high rates of community spread. That said, there are different parts of the country that have higher rates of vaccination and boosted rates. And we see that, and of course, in New York. Personally, I feel like I'm a little concerned that this is happening right now and feel like we should have a little bit more time and see those cases continue to come down. However, I do understand also the feeling that people have of wanting to be over with Omicron and over COVID. I'm just afraid it's not quite over with us yet.
And let me ask you about something else in the news here. That's drug maker Johnson & Johnson. They're halting production of their COVID-19 vaccine. It's a single dose. What's behind this move here?
Well, I was just looking into some of that information. It appears that there are some other vaccines that they also want to work on. And if you take a look at Pfizer and Moderna, really are the big vaccine manufacturers that we're seeing in the United States, of course, over in Europe. So I think that's some of it. Now, some of the information that I have seen is that they plan to pick this back up again or pick back up production of their COVID vaccine. But when you see how COVID has been responding to J&J versus Pfizer and Moderna have shown to be more efficacious. So that may be some of it there, but that's a limited amount of information that I have so far, Jared.
All right, I appreciate that. And then also the CDC, they need to approve young kids' COVID shots, but they're telling the health agencies that they're not going to expect delivery until February 21st. Is that sooner or later than was expected? Just wondering what the status is there.
Well, they are taking a slightly different process this time. And so the change this time is that they are doing more of a rolling type of review process into this vaccine and this amount of vaccine for children under the age of 5. And I think part of the reason why is they know that it's safe, meaning that they've had studies that have looked at being safe, and we've had billions of people vaccinated with the vaccine. And we also we've had kids over the age of 5 vaccinated with Pfizer's vaccine. So we have a pretty good sense that it's safe. Now, the question is whether it's efficacious. And from what we've heard from Pfizer, they believe that it's a 3-dose type of regimen versus a 2-dose. But they want to do this in a rolling fashion to get out from a timing perspective ahead of that delay. So getting kids shots in arms early, knowing that there's likely going to be a 3-dose regimen associated with this. So I think the same process is going to be followed from a review perspective, but they want to do this in more of a parallel fashion than a serial fashion. So that's more of a rolling type of review process than waiting for step 1, step 2, step 3. So I'm confident that when the FDA reviews the data, when it comes out, that we can feel that that not only is the vaccine safe and efficacious.
And just getting your boots on the ground perspective as an emergency physician in the DC area, what are you seeing right now? Because we're seeing the numbers come down precipitously as we've been talking with other guests from elevated levels. I'm just wondering what your capacity is looking at right now.
Well, I think what's really important is that we need to kind of segment out cases versus what's happening in the hospitals. Hospitals are starting to see a decline. We're seeing that here in the DC area, but death rates are, of course, at a significant high. We still have a lot of patients within the ICU setting. Remember, cases happen first. Hospitalizations, we start to see those peak second, and sadly, we see deaths happening a little bit more delayed. So even though we're seeing a big decline in cases across the board, that doesn't mean that our hospital systems are not under significant strain. We do see a light at the end of the tunnel. We're just not fully out of that tunnel yet. And Jared, I just want to remind folks, for 2 years, our doctors, nurses, and healthcare workers have been under an unprecedented pressure associated with this virus. So while the things may be getting slightly better, we still are going to have to address some of the significant strain that our healthcare system and our healthcare workers have faced.
Well, let's follow up on that because I think most of us have a little bit of COVID fatigue, but I could only imagine
Yes.
what you and your professional colleagues have been through. What's the reach here? Is there some kind of reach out program for mental health targeted at healthcare professionals? Because I can only imagine what they've been going through over these last 2 years.
Well, quickly, what we've done at my organization and our medical group is to ensure that our clinicians and even our clinical support staff members have access to free therapy. We have been doing that. But that is addressing the problem. That's addressing the back end of the problem. We need to start looking at how to address the antecedents to PTSD, the antecedents to burnout, and to what are the things that are causing people to not feel well in their professional life. And so that's everything from some of the resourcing that are there at the hospital, some of the expectations that are put on doctors and nurses. There's a host of things that we're looking at now to address those issues of what are the causes of burnout and making our teammates not well. So I think there's a lot of work that needs to be done. And I think that once this crest and wave starts to pass, that's where a lot of our focus needs to start turning is how do we protect those who protect us? Because if we don't, then our safety net is completely compromised.
And Doctor, we got time for one more quick question. I got to say, I love your background there, the color scheme, all of it. Looking at it right now, is that a dog with a red cape behind you on that pillow?
That is, and I do have Maximilian Alexander von Westerdorf the Great, my Great Dane, looks just like him. So one day you may see him.
Very good.
We call him Max for short, Jared. We call him Max for short, so don't worry.
Hey, I got a dog I'm babysitting right here next to me, too. I love dogs, and it's a good dog day here. Dr. Adam Brown, thank you for joining us here. Always good to see you. Emergency physician and COVID-19 National Task Force Chair at Envision Healthcare.